Service Committee will now come to order. Madam Clerk, could you please call roll?
Ms. Andrews? Dr. Carbone? Chairman Colby?
Here.
Mr. Delahanty? Mrs. Draw? Ms. Cayley? Mr. Lightfoot is excused. Dr. Quattro? Mr. Terp?
Is there anyone signed up for public forum?
There's not.
Is there anyone present that would like to address this committee at this time? Seeing none, the next item on the agenda is approval of the minutes. You have the October 21st minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. We have a presentation today by Robert Frankel, the Chief Financial Officer. Franklin, whatever. It's my last day. Fire me. I can go home, sir. Presenting the 16th budget as it pertains to human services, please. Yeah, move your mic. Oh, no, you already did. What the hell's the sleeping spot? Sleep.
What the heck? Not responding. Well, good evening, ladies and gentlemen. Appreciate the opportunity to present the 2016 proposed budget as it pertains to the Human Services Committee. As with other committees, I'd like to begin with an overview of the 2016 proposed budget, just to give an overall context. Our proposed budget for 2016 is standing at $1.174 billion. That represents a decrease of about $7.9 million from the 2015 adopted budget. The largest portion of our budget, the operating budget, stands at $999.2 million. Also represents a decrease from 2015 adopted by about $5 million. Overall, our 2016 proposed budget maintains a tax rate of $8.99 per $1,000 of full value. It reduces overall county headcount by 3.75 full-time equivalents. It reduces mandated spending by about $5 million and complies with the Taxpayer Protection Act of 2007. And since the issue arises from time to time, I think it's important to note that the definition of what is a mandated service has not changed from the 2015 budget. Those departments within Monroe County pertinent to the Human Services Committee are shown for you. Quite a few changes. Most significantly, our Department of Human Services, quite a significant reduction in overall appropriations. And we'll go through each of these in a few more slides. I would be remiss if I didn't comment on public health. Public health appropriations are also lower. It's about $4.6 million. And as probably will come up in questions later on, almost entirely the public health reduction is related to grants showing up in the 2015 amended budget, but not appearing in the 2016 proposed. Our budget for Monroe Community Hospital is largely unchanged, but I'm sure you'll notice once we get into the budget book that this year, 2016, we are not budgeting any subsidy from the county's general fund. Looking at our Department of Human Services, again, I commented that there is a significant reduction overall appropriations. Be that as it may, Department of Human Services still represents about 45% of the overall county budget. Again, appropriations overall down about $17.8 million. There really is, there's 1,000 lines in the DHS budget, so there's a lot going on. Let me give you some notable highlights. They've had a lot of success over the year in helping their temporary assistance clients become self-sufficient. As such, their temporary assistance caseloads have been coming down. That saves approximately $6.5 million in appropriations. Reduced Medicaid appropriations, they're actually lower by about $3.2 million. That does include about $1.2 million in lower, what we call Medicaid direct payments, payments made by Monroe County on behalf of Medicaid beneficiaries. And also about $2 million in reduced liability for the capped Medicaid payments to New York State. We also have reduced appropriations within our adolescent care, child welfare, and purchase of service contracts. That totals about $5 million. And even though I keep talking about a lot of decreases, I'll point out notable, one of the larger increases in mental health. Mental health appropriations are up about $2 million from the 2015 amended budget. Looking at just a couple of the larger divisions within Human Services, the Division of Financial Assistance. The division operations, where the management of the program takes place, has lower appropriations from 2015, largely due to the end of a claiming project related to Medicaid overburden cases. It's a little technical, cases where the state of New York should have covered a greater portion of the expense, but for a variety of reasons, counties bore that financial burden, and there was actually a project to recoup that money. There were also some downward adjustments in fee-for-service contracts, such as employment assessments and contracts for case management. Within the safety net and financial assistance divisions, the reductions you'll see in those appropriations are commensurate with forecasted reductions in overall caseloads. Again, Medicaid, also lower, savings from the additional enhanced FMAP the county is receiving. It's a slight increase in percent each year for the next couple of years until the federal share for certain clients becomes, I believe it's 93%. Daycare. Before anybody panics when they see a reduction in daycare appropriations, I do want to point out that last year's proposed 2015 number was $38.4 million. What's included in the 2015 amended number, but missing from the 2016 proposed number, are the dollars associated with the Facilitated Enrollment Demonstration Project. It used to be called Child Care Dollars locally. It's now managed by the Workforce Development Institute. That program has about $1.65 million that will roll into January of 2016. Those were appropriated in the 2015 budget. They don't appear in the 2016 proposed, but will roll over. The state budget will come out April 1st. We fully expect to have a new allocation for the Facilitated Enrollment Project going into April of 2016. So that also will add to the overall daycare appropriations. Within the other large division of Human Services, our Child and Family Services. Again, quite a number of things going on within the division. Child welfare appropriations, cost reductions can be attributable to a shift from more costly institutional placements into more lower cost residential and family placements. They also have lower costs associated with adoption subsidies, a lower projected maintenance cost of special education students who are placed by school districts into other institutions like in Easter Seals. The Adolescent Care Division, it's a small increase overall. In the budget book, when you get into the details, you notice a dramatic increase in our JD and PINS populations, the juvenile delinquents and persons in need of supervision. Frankly, those costs are going up quite a bit due to an increased number of judicial placements. Also within adolescent care, even though the JD PINS is going up, there's an offsetting decrease related to the juvenile justice facility charges. Those are the facilities like Industry, run by New York State. the 2015 state budget actually capped charges to counties for children placed in those facilities. Our purchase of services contracts, this actually came up last night in our discussion with the Public Safety Committee. Appropriations between 2015 and 16 are going down, but it's important to point out what we discussed last night. In prior years, Human Services used to contract and pay our Office of Probation and Community Corrections about $2.5 million for their work in serving both the youth in probation, also involved in social services. New York State has cracked down on reimbursement to DHS for those types of contracting arrangements, not just in Monroe, each county that had such a contract. So there is no longer state reimbursement for that. With no state reimbursement, there really isn't much point in having DHS contract with probation. I want to point out that the services are still being provided. Our Office of Probation is mandated to provide probationary services to youth. It's just that DHS isn't contracting for it. So the cost shifts from Human Services to probation. There is a slight reduction in daycare. This is the daycare that pertains to preventive protective services. Often to prevent a foster care placement, a family may be in need of additional services. Sometimes those services are assistance with daycare. Turning to our Department of Public Health, as I mentioned earlier, public health overall appropriations are reduced about $4.6 million. It is almost entirely related to grants being in the 2015 amended numbers, but absent from the 2016 budget. I presented to you the division level appropriations. When you get into the budget book, you'll see again there's a lot going on in there. I will say the largest division, Special Children's Services, that's the large division that includes our early intervention and our preschool special education programs. Monroe Community Hospital, I did mention largely their budget is unchanged from 2015. Last year there was a clear as mud discussion on the Medicaid upper payment limit. We used to budget for that in the general fund. In 2015, the first year, we moved that over to the hospital. So while the hospital receives a large payment from New York State, that payment comes with a local share responsibility, and that responsibility is borne by Monroe Community Hospital. And I also would point out, as I believe I made a comment, we are no longer, in 2016, you will not see the general fund providing a operating subsidy to the hospital. In 2015, I believe that subsidy was budgeted at $600,000. Last but certainly not least is our Veterans Service Agency. It appears to be quite a dramatic decrease in appropriations from 2015 to 2016. At the risk of sounding like a broken record, this really is 100% attributable to a $185,000 grant from New York State Office of Mental Health that was received in 2015 and therefore not appearing in the 2016 numbers. Just to give you a little flavor of what's going on in our Veterans Service Agency in 2016, this is kind of nice. They're actually working on establishing a Veterans Driving Veterans program in collaboration with Compeer Rochester and Lifespan. This is for veterans who may have mobility problems and transportation problems. They're actually also expanding their outreach plan to target specific populations or specific pockets of veterans that may have typically been underserved in the past, such as like the National Guard or reserve units. So this is a new area that the Veterans Agency would like to get into. Mr. Chairman, with that concludes the presentation.
Thank you. At this time, I would like to, we already did that. You don't want to do it again, do you? We will entertain questions as it pertain to the Human Service Committee budget of 2016. Dr. Carbone has his hand up.
Thank you, Chairman. Through the chairman to the administration, I see there were several objectives in the 2015 budget that do not show up as major accomplishments in the 2016 budget. I'd like to address these, and hopefully the administration could give me some answers in writing before the full legislature meeting. In the financial assistance portion, number one, enhanced eligibility requirements to include active job search, a recertification, diligent oversight of restoration to self-sufficiency activities for people with disabilities, and improvement management of the families who have received state-funded assistance for 5 or more years. Number two, increased technology, including use of the state's I/EDR and Annex to manage HEAP workload. Over 67,600 Monroe County households receive help paying their energy bills through HEAP for the 2013-2014 heating season. From the Office for the Aging, the objective to partner with the Monroe County Department of Public Health and MCOMH on projects and delivery of best practices to improve access for older adults to health care and change stigmas for behavioral health. Number two, improve health outcomes for all Monroe County residents through improved access to health care and by embedding behavioral health into primary care facilities. Number three, the Balanced Incentive Program funding will increase access to long-term care information and supports for persons with disabilities and identify older adults who may be Medicaid eligible to improve opportunities to continue to live independently in their homes. Improve the current phone system. From the Office of Mental Health, MCOMH will ensure transformative state-driven initiatives, transition to Medicaid managed care environment, transition from inpatient psychiatric system of care to community-based living and recovery support services, and delivery system reform. Incentive payment programs are implemented locally to best meet the behavioral health needs of the community while ensuring a robust provider network is available to support these needs. MCOMH, number two, MCOMH will partner with Monroe County departments to develop and implement a neighborhood-focused approach to support the Monroe County goal for improving the quality of life for children and families. MCOMH will implement a multi-pronged approach to reducing forensic court-ordered expenditures, including taking a lean process improvement approach to reducing inefficiencies and increasing opportunities for savings and reviewing utilization patterns for individuals that discharged and successfully maintained within the community. In addition, MCOMH made contact with the New York State OMH Associate Commissioner for the Division of Forensic Services regarding opportunities for piloting initiatives that could drastically impact court-ordered expenditures. On the Monroe Community Hospital section, reduction of employee turnover and a corresponding decrease in projected use of agency non-employee staffing and costs. Increased visibility and community awareness of the Monroe Community Hospital Foundation with the goal of expanding the donor base and enhance Monroe Community Hospital programs through increased contributions. Number three, reach out to the community through the auxiliary to increase volunteer resources to support staff in meeting the needs of our residents. In the public health section, early intervention in preschool, modify the current EI intake process, obtaining and documenting developmental screening information. Environmental health, implement a new tattoo and body piercing licensing and inspection program following the adoption of New York State regulations anticipated to be finalized by 2015. Epidemiology and disease control, develop annual Monroe County Health Indicator Report using data from CHIP and reportable communicable disease. Nursing services, implement barcode scanners in conjunction with Center for Disease Control, which will improve inventory control and enhance efficient documentation and reporting of vaccine doses given. TB, provided patients visits the TB clinic and the community while adding facilitated enrollment services for refugees to obtain other health care services. Starlight Pediatrics, implement a plan for enhanced mental health services for children in foster care. Continue to work with New York State Department of Health to fund enhanced case management for all children, increasing the reimbursement rate for various clinic services. Office of the Medical Examiner, improve turnaround time in all areas of the OME, resulting in more rapid case completion, strengthen existing inter-county relationships to improve regionalized forensic services, implement portable technology in field operations. In the Veteran Service Agency, it appears that everything listed as an objective for 2015 is either covered in the 2015 accomplishments or listed as ongoing in the objectives for 2016, and I commend the administration for that. Thank you, Chairman.
Thank you. I assume the administration got that? I'm sure he will supply that in writing to you. Is that correct? Yes, I do. Is there any other questions at this time? Legislator Andrews.
Thank you, Mr. Chair, and thank you, Legislator Carbone. I think that was a very expedient way to ask a lot of questions that were quite similar in nature to some we asked last night. Thank you. Thank you. Yeah, that's cool. Thank you. I'd first like to thank Mr. Franklin, Commissioner Reed, both of your staffs and your teams for all the hard work that you've put into this budget each year, and especially this year, and for being here this evening and giving us an opportunity to ask some questions of you. Your presentation this evening was very thorough, so I'm trying to not be repetitive because you covered a lot of the topics that I was certainly going to ask about. I think I would just like to start with a quick question regarding your overview of the budget. I believe you indicated through the chair that mandated spending was down by $5 million in the 2016 budget. So my question is, how much was either non-mandated spending down by or up by for next year?
Mr. Chairman, non-mandated spending is actually up this year, about $133,000.
Thank you. Through the chair, and what percentage would that be?
That's, Mr. Chairman, a 0.2% increase over last year.
Thank you. And through the chair, what does the Taxpayer Protection Act allow for this year?
Mr. Chairman, the TPA follows the Consumer Price Index for all urban areas, which has published in September for the month of August. 12-month period was 0.2%.
Perfect. Thank you. Through the chair, could I ask you to identify the amount of the indigent burial chargeback for 2015?
Mr. Chairman, just to clarify, the actual amount charged back on the 2015 bill?
Yes, please. And then the projection for 2016.
I can get that information for you, Mr. Chairman, both actual on the 2015 bill and what we expect on the 16 bill.
Thank you very much. Through the chair, is there any allocation in the budget for a $50,000 shelter for the temporary homeless this year?
Mr. Chairman, there is no appropriation for that this year.
Thank you. I don't believe Legislator Carbone asked about this question under major accomplishments on page 140 under the Child and Family Services. My question really is not the status necessarily of the accomplishment, but a question of what is the Intensive Family Support Preventative Services program.
Mimi Natale, the Director of Child and Family Services. Through the chair, the Intensive Family Support Program was a focus to provide in-home intensive services to families struggling with difficult to manage behavior in the children who have been the subject of abuse or neglect, the purpose being to stabilize placements and decrease the need for foster care.
Thank you. And through the chair, does that program continue on in 2016?
Through the chair, it does.
Thank you. On page 141, under the Youth Bureau accomplishments, it mentions the Monroe 200 initiative, which I know the county executive has spoke about in chambers earlier this year. My question is, how much did that initiative cost, through the chair?
Mr. Chairman, rather than take an educated guess at that number, we're going to get back to the legislator with the real answer.
Thank you. Also, following up on that through the chair, I believe there were 200 participants in it, and my question would be how many of those were county employees or interns?
Same answer.
Mr. Chairman, we'll have to research that.
Thank you. And then also, I'd like to know if they received comp time or any sort of compensation for their participation.
Yes, Mr. Chairman.
Thank you. On page 149, the number of child protective cases is continuing to increase, an estimated 8,300 in 2016, which is a significant increase from 2014 actuals of 7,155. What percent of these cases are indicated?
Through the chair, last year, the indication rate was 22%. It fluctuates some, but at this point, year to date, I'm sorry, it was 25% last year? Yes, excuse me, I'm sorry. Through the chair, it was 25% last year. It is a number that fluctuates some. However, we believe that it's around 25% at this time year to date for 2015 as well.
Thank you. I know that there's a new hotline that's in place now that perhaps is causing some of the increase in the number of cases, but do you have any other explanation that could cause such a significant increase in the number of CPS cases? I mean, we have talked about this over the years. Through the chair, please.
Through the chair, I would continue to say to you what I've said in previous years, which is that nationally, folks are recognizing an increase in child protective reports across the nation. That has happened actually across the state of New York as well. We did see an increase when we switched the hotline to New York State. However, I would suggest to you that a portion of that is the fact that we've had a tremendous focus on children and safety in the community since we've implemented the poverty initiative. We continue to have Out of the Dark as a major initiative in the community as well. The more we talk about the issues of child abuse and neglect and make it okay to say it out loud, the more likely it is we'll see increases.
Thank you. Through the chair, then, would you expect to see further increases in next year and the year after?
Through the chair, we typically experience a moderate increase year to year.
Okay. Thank you. On page 150, under the financial assistance repayments, are dropping significantly from almost $8 million to a little less than $2 million. Is this just a result of the Child Support Enforcement Unit moving over, or what's causing the drop here? Through the chair.
Actually, Mr. Chairman, that really is more related to the end of that project to reclaim Medicaid overburden costs.
Okay, thank you. I think you mentioned this in your presentation through the chair, the caseloads for family assistance and the decrease in cost projected for next year, and you mentioned that was because of the caseloads. Looking at the number, it appears, though, the caseload projection is only dropping by 3, from 6,297 to 6,294. How would a drop in just 3 caseloads generate a cost that's dropping by almost $3 million?
Can I just clarify the page number, please?
Yes, 163.
Mr. Chairman, the appropriations required for both family assistance and safety net are partially driven by the size of the caseload and the cost associated with those cases. It is a multiplying situation. Family assistance, while the caseload may appear to be declining, only 3 cases, that is a monthly average. Caseload reductions earlier in the year, which we anticipate to start 2016, reflect more magnitude throughout the year than a caseload reduction late in the year. However, family assistance is probably, I don't have the number in front of me, cost per case. The cost per case for family assistance is also declining. Yeah, Mr. Chairman, the adopted budget for 2015 had a family assistance caseload of 6840. That's a monthly average. The 2016 projected is 6294.
I see.
So that is a significant reduction in caseloads. Thank you. Regarding the safety net caseload, Mr. Chairman, the caseload between the 2015 adopted and the 2016 proposed is actually a reduction of 423 cases. The cost per case, not so much of a decrease, $625 in 2015 versus $617 for calendar year 2016, but a reduction nonetheless. So those 2 factors also contribute to a dramatic decrease in appropriations.
Thank you. Through the chair then. So the budget figure we're looking at and comparing was based on that 6840 caseload figure, not the one that we're now using for the end of 2015, that's 6297.
Correct, Mr. Chairman.
Okay, thank you. I know you touched on this in your presentation regarding the Medicaid cap payment. That appears to be dropping next year. Is that considered a mandated expense in the budget?
It is, Mr. Chairman.
Thank you. In turning to talk about daycare for a few minutes, I think I followed what you said regarding the facilitated enrollment program, and I know that kind of fluctuates and gets to roll over a little bit year to year. Can I just ask, though, directly, is the local dollar amount support for childcare remaining consistent in 2016 from 2015, or is it changing?
Mr. Chairman, I'm going to give you a split answer to that question. The portion of daycare that typically is most important to this committee and to our advocates is the daycare, low-income daycare, and to a certain extent, family assistance daycare. Those are the 2 daycare programs funded by the Child Care Block Grant. Given that context, the funding for those programs, and I'll clarify, Mr. Chairman, I believe, but I'll clarify if the question relates to Monroe County funding.
Yes.
Mr. Chairman, the level of Monroe County funding for that area is consistent with 2015. It's about $4.4 million. Overall, don't forget that daycare includes preventive protective daycare, daycare offered as a case management tool to families at risk of a foster care placement. That actually is coming down a little bit for calendar year 2016. It's a decrease, Mr. Chairman, of about $120,000, give or take.
And through the chair, then, is that reduced county funding or state funding or even something else?
Mr. Chairman, that would be county funding.
Thank you. And why is there a reduction of $120,000 of county funding for those 2 programs?
Mr. Chairman, for the preventive protective daycare, that really is a function of the cases served by the Child and Family Service Division and the trends in how often daycare is seen as an efficient means of preventing a foster care placement.
Okay. So you are then saying that next year you expect daycare to be less of an effective means in those situations than in this year?
Mr. Chairman, the overall foster care placements are relatively unchanged between 2015 and 2016, but we are seeing a shift into family placements. But I don't know if there would be a commentary on whether daycare is an effective tool, perhaps more a commentary on how often it is necessary. We do have our Director of Child and Family Services.
Through the chair, we often use preventive daycare as a means of avoiding foster care placement. If we have a parent who is struggling to meet their child's needs for whatever reason, sometimes the addition of child care allows that parent to engage in services that decrease the level of risk within the home that allows us to avoid a foster care placement. We can also avoid foster care placements by using relatives or family friends to care for children. It's very common that in those instances, the family member would need assistance with daycare. Providing daycare in that instance, again, provides the opportunity to avoid a foster care placement.
Okay, thank you. I have a question then regarding the caseload projection, or not the caseload, but the number of children who we expect to receive subsidies for next year. It appears to be dropping by another 300 or so in the budget book on page 153. So what would be driving that projection? Through the chair.
Mr. Chairman, just to clarify, the question relates to the number of children.
Yes.
Is that correct? Mr. Chairman, the number of children receiving a daycare subsidy in the family assistance caseload is actually increasing from the 2015 projection. It is a slight decrease from the 2015 budget. The number of children in low-income daycare is actually an increase from the 2015 budget. The 2015 budget was 3,138 children. 2016 budget is 3,349 children. Often, the number of children able to be served in these programs, specifically low income, is driven by the cost of care. Cost of care not only in low income, but don't forget family assistance, because that also is paid first by the Child Care Block Grant. The cost of daycare within family assistance actually dramatically increased from $5,600 and change in 2015 to almost $6,300 projected in 2016. There was more than a $650 per child increase.
Okay. Historically, through the chair, I guess when I've looked at the daycare figures, I have added the 3 categories on page 153 to compare actuals from 2014 and the projections for 2016 to get what you're thinking, how many families we think we'll be serving next year. But when I do that this year, it appears at least to be a reduction of almost 300 families. So could I get from you what you're expecting then? For
Yes,
caseload
Mr.
next year?
Chairman, that is accurate. With these programs, it is an overall reduction in the number of children. I would point out, as I mentioned in the presentation, what we don't reflect in this year's budget is the Facilitated Enrollment Demonstration Project. With the additional funding received in the budget this past April, they are expecting to serve roughly 350 children on average per month. Typically, our budget book last year, since we did include facilitated enrollment, we would have also reflected the number of children served in that program. It's not a dramatic change in number of children, but perhaps a reduction reduction given the increase in cost per child.
Okay. Thank you. Now I have a couple straightforward questions regarding childcare, if you don't mind. First, could I just request the breakdown by the 5 programs of the number of children for 2015 by month that you usually provide me this time of year?
Yes,
please?
Mr. Chairman.
Thank you. Also, question regarding budgeting for next year through the chair. Did the eligibility level, did you project that to stay at 165 for the whole year?
Mr. Chairman, the Department of Human Services actually serves children to 200% of poverty, consistent with New York State's social services law. We do prioritize families during times of insufficient funding, prioritizing families at 165%, and that has not changed.
Thank you. And for next year, you're prioritizing families at 165, correct?
Correct, Mr. Chairman.
Thanks. Through the chair, is the parent contribution rate staying the same throughout next year?
It is, Mr. Chairman.
And through the chair, is the quality differential projected to stay the same as well?
It is, Mr. Chairman.
Thank you. Was there a market rate increase in 2015 through the chair?
The last market rate increase was effective April of 14.
Thank you. Do you know if there's one projected for 2016?
Mr. Chairman, we haven't heard that yet.
Thank you. Through the chair, do you have any idea how many children in Monroe County are eligible to receive child care subsidies but aren't receiving them?
No, Mr. Chairman, the department does not collect that information.
Thank you. Through the chair, talking a little bit about facilitated enrollment. So if I heard correctly, you're rolling $1.65 million from 15 into 16 for the facilitated enrollment program. Is that accurate?
Yes, Mr. Chairman.
And then through the chair, do you expect an additional allocation on top of that, or is that what you expect will happen?
We do expect an allocation, Mr. Chairman, in the next state budget.
Thank you. Then the 1.65 million, is that what would serve the 350 children? And so there's possibility we'll have more, or do you need to receive more in order to get to that 350 number?
Mr. Chairman, the 350 is generally an average number. I would not expect on a month-to-month basis the number to change. Given the unknown of the state budget, assuming it comes in consistent with prior years, I would expect 350 children per month.
Thank you. And then one of my favorite nitpicky questions. A couple of years ago, the county executive established this child care trust fund for donations. I believe last year was stated that that trust fund is not part of the budget, but that the balance was $1,130. Could I ask for a status of what the balance is now, and if any of that money has been expended to support child care through the chair?
Mr. Chairman, the money remains in a trust fund, although I would suggest that the county has met the conditions for spending that money, basically reimbursing ourselves. I will, however, follow up with the current number of donations and dollar amount, although I believe it is unchanged.
Thank you. And could you just clarify what you mean by reimbursing yourselves through the chair?
Mr. Chairman, in federal fiscal year ending 2015, the Department of Human Services actually spent more on daycare than was originally budgeted. That would meet the conditions for tapping into that trust fund.
Okay, thank you. Question regarding the purchase of service contracts. You did touch on this regarding the shift from probation. Could I request a copy of the list of purchase of service contracts and their amounts for 2015 and 2016, please, as well as the percentage of those contracts that go to evidence-based programs?
Yes, Mr. Chairman. Mr. Chairman, the Commissioner is advising me, by the way, we do have an expression of interest that will soon be released for 26. It's on the street right now.
And through the chair, what does that mean?
An expression of interest, Mr. Chairman, is just a little bit different from a request for proposals. We're not looking for proposals. We're looking for entities in the community to express their interest in assisting the department with serving those families needing preventive or protective services.
Okay, through the chair, then how does that affect these contracts? Is that new, or is that something you do every time this time of year?
Through the chair, it is due this year that we are asking for expressions of interest. for the types of preventive service that we require for our families.
And through the chair, then how does that change the process you've used in the past? Or does that mean certain agencies that historically have received funding will no longer, or what are you expecting to happen?
Through the chair, that would be a possibility. Some may have chosen not to apply or express a level of interest in what we need. One of the things we've discussed here in the chamber in the past is that we purchase what we need for the time that we need it, and then that might change. So while there may have been a historical period of time for a particular contract, may not be something that we're in need of now. So you may see a change as we go into 2016 with the agencies that we are contracting with for service, and or the amount of money that we're contracting with them for.
Thank you. Through the chair, are agencies aware of this if they're going to no longer receive a contract or receive a significantly reduced contract at this point in time?
Through the chair, they were aware of the EOI. All the agencies that we work with received it.
Thank you. And then when I receive the list of the 2006 contracts here, will that be evident on that list?
Through the chair, 2016?
Yeah.
Yes.
Okay. Thank you. Turning now to the Office of Mental Health, you mentioned this also, Mr. Franklin, in your presentation. Could you explain why agency contracts are increasing rather significantly in that department?
Through the chair, this is David Putney, Director of Mental Health. We have a few different items. One overall change had to do with COLA and rent stipend increases through New York State Office of Mental Health, which increased $315,000. There was also a significant change through the New York State Office of Alcoholism and Substance Abuse Services, where individuals were automatically eligible for food stamps for certain types of housing, and that was terminated. Therefore, New York State OASIS added in $422,000 going out to the contracted providers to make up the difference so they could provide for those individuals. Because traditionally those food stamps would then go into the overall part of providing food for those individuals where they were living. There was a significant amount added in terms of New York State OASIS to support statewide initiatives around contracting for supports for a prevention IT system. State Education Department MOU for Prevention Services is included there, and Combat Heroin Media Campaign. So these are dollars that we can handle and then push back out at about $3.8 million.
Thank you. Thank you, Mr. Putney. I have a follow-up question on that, actually, because that was leading into my next question, is I feel this year we've heard a tremendous amount about heroin addiction and opioid addiction and problems. Certainly not unique to our community, but across the country and definitely occurring in our community. My question really was, it hasn't come up before this committee at all, and I wondered what the Department of Mental Health was doing in this area, if you would speak to that.
Through the chair, thank you very much for asking. Actually, I was just on a call today with my counterparts across the state where we were providing updates about various approaches to this. Our office certainly ties into all of the initiatives that the New York State Office of Alcoholism, Substance Abuse Services, I'll call it OASIS from now on, so I don't have to say the long thing every time. But they have a significant media campaign where they're pushing out, in my era, we called them shorts. What do you call them now? Previews, we call them, whatever that is in the movie theaters. So those are coming out, trailers, I guess they're called now. So that's one approach. Another are presentations to schools. One issue that myself and my counterparts brought back to the Commissioner of OASIS was that they have expended significant dollars, and well so, in the greater Albany area on media campaigns, but we've not seen the same push out to other regions in the state, so that remains a concern. We rely on our partners, our contracted providers, to conduct various trainings for the community, specifically including provision of and how to use Narcan kits. Narcan, which happens to be the antidote. I'm sure most people have heard of that. You don't need to be a medically trained individual to provide those. So we endorse that, and we've encouraged as many community folks to participate as possible. We even had a local sorority express interest because they had lost one of their members this past year, very sadly, due to heroin overdose. I actually am attending a roundtable discussion later this week where one of our local prevention agencies is bringing in the chief of police for the city of Gloucester, Massachusetts, where they've adopted a unique approach which looks for opportunities to assist individuals to gain entry into treatment rather than charging for offenses that don't necessarily need to be charged when clearly there's no other related criminal activity involved other than the possession of instruments, et cetera. So those are a few, but I'd be glad to speak about it further in the near future if you would like.
Thank you very much. I
Thank
appreciate
you.
the information and might take you up on that too. I have another question regarding programming for another area under mental health, and that's in the area of suicide prevention. There was a report, I can't quite recall who released it, just a few weeks ago, regarding men, I believe, maybe perhaps in the 40s to 70s age range, and increased rates of suicide and drug addiction. And I know it's also a very troubling problem within our veterans community, and I just wondered what your thoughts were on what we could do to address that.
Through the chair,
problem.
thank you for raising that as well. There are a multitude of efforts going on in that area. Of course, our local Veterans Administration spearheads many of those efforts, and Veterans Administration handles the crisis suicide hotline, which also provides suicide or other crisis calls response system across the nation. We participate actively and promote the activities of the Association for Prevention for Suicide Prevention, including their annual Out of the Darkness Walk, which raises a significant amount of funds for education and prevention. We also, our office has a program called the Consortium on Trauma and Illness Through Grief. I would encourage you to check that out. Actually keying in primarily on school-age children. You may have heard some stories in the media recently about suicides and conjecture, at least, if not some research around what could have led to those suicides. And the Trauma and Illness and Grief Consortium actually goes out and does trainings with school counselors, school personnel, and actually advises about protocols and response as well as prevention. Around the suicide issues on the older adults, that was brought to our attention over the last couple of years, especially by our substance use providers. People become hopeless, helpless, often turn to substances. We've seen a spike in that actually recently in high school children as well. And so we continue those efforts to outreach, but primarily keying in for the kids through the Trauma and Illness and Grief Consortium, on the adult and more through our substance use and mental health providers.
Great. Thank
Before
you very
we-
much.
Just try to keep everything related to the budget. We're kind of veering off here a little bit, both you and administration. Try to tie everything back to the budget. These are important questions, but right now we're discussing the budget.
Thank you. I will. Okay. Moving on to retirement costs then.
Thank you.
Thank you. Mr. Franklin, I think you explained this last night, but I couldn't quite capture it all. Could you just, again, explain why we see some increased retirement costs in certain departments and decrease in others? I believe you explained, it was sort of how you're accounting for it or how they're being budgeted this year.
Mr. Chairman, pension costs are budgeted as a percentage of salaries, and the department and division to which a particular employee works will receive the budgeted amount for pension. However, when we pay the bill in February, the Controller's Office actually allocates the pension expense more so where the county receives more reimbursement for the cost. For example, since we're in the Human Services Committee, if the budgeted pension for social services is $1,000, but because we amortize a portion of our actual payment, I don't want to charge social services less than what we budgeted, because I know social services gets reimbursement for those costs. Therefore, I'm going to allocate the full budget to social services when we pay the bill.
Thank you.
Any other questions?
Yeah, sorry, just a couple more. I was just checking in with Cindy. Yes, Nurse Family Partnership Program, is this through the chair's funding level the same for 2015 and 2016?
It's consistent, Mr. Chairman.
Thank you. On page 723, under nursing services, why is federal aid dropping $3 million?
Mr. Chairman, this will be related to grants showing up in the amended budgets, but not the 2016 proposed budget.
Thank you. And then under MCH, you mentioned in your presentation the county's general fund is no longer contributing a subsidy. Why is that, through the chair?
Mr. Chairman, that is because Monroe Community Hospital is becoming more financially sustainable on their own. They do incur a little bit of an operating loss last year that was mostly an accounting accrual for required other post-employment benefits, retiree health insurance. So as long as their loss is contained within that accounting accrual, they're doing quite well.
Good. I'm glad to hear that. A couple other questions about MCH. On page 203, why are personnel services going up $1 million in 2016?
Mr. Chairman, the director of MCH is here.
Thank you, Mr. Franklin. Through the chair, the personal services amount increases as a reflection of the increased usage in temporary agency help. There would be a corresponding reduction in the salaries and personnel lines.
Thank you. Through the chair, then, is the hospital laying off any staff as a result of that change?
No. It's a matter of our inability to recruit employees because of the marketplace and national shortages in the nursing profession.
Thank you. Through the chair, then, are the titles that are going to be temporary help mostly nurses?
Pardon me?
Is the temporary help then mostly nurses through the chair?
Through the chair, primarily LPNs and CNAs.
Thank you. Page 204, what's the current occupancy rate at the hospital?
It's approximately, through the chair, approximately 94%.
Thank you. Are there any efforts being made to increase it through the chair?
Through the chair, part of that, ma'am, is a misleading representation of the census, because you have to look at an overall analysis of how the bed count at MCH is utilized. We have a number of residents at the facility due to behavioral or other clinical reasons that cannot have roommates. And we have a number of rooms that are semi-private that in essence are locked from the ability of providing another person in that room. So if you examine our census from the terms of available beds as opposed to empty beds, the census number significantly increases to about 97.5%.
Thank you very much. Page 558, overtime costs are pretty significant for the hospital at $2.6 million. Do you have a rationale for that, or would there?
It's again a reflection of the fact that we are unable to recruit enough staff to fill our available positions.
Through the chair, then, is that you expect that cost to decrease with the use of the temporary help through the chair?
Through the chair, that cost would decrease if we increase the usage of temporary help, yes.
Okay. Through the chair, then, have you considered raising wages in terms of increasing likelihood of hiring people?
I'm sorry, would you repeat that, please?
Through the chair, it just sounds like you have a difficult time with recruitment. Is there any possibility of increasing wages to attract people to those positions?
Through the chair, those wages would be determined through union contract and union negotiations.
Through the chair, I'm doubtful they would resist increasing wages.
In fact, we have a number of proposals that we have provided to the union to present some creative ways to provide additional opportunities to people in the local marketplace. Just as an example, we have proposed adopting what's called a Baylor program, which provides nurses the ability to work 2 16-hour shifts on Saturday and Sunday and get paid for 40 hours. That's just an example of one of the proposals that we've made to the union as a way to increase recruitment, and we are awaiting their response.
Great, thank you. Just a couple more questions in this area. Page 558, the cost of the medical affiliation contract with Strong has increased 27% since 2004. What's driving that cost increase through the chair?
It's simply primarily the increased cost of providing the staff of the URMC provides to us, the cost of physicians, the cost of nurse practitioners, and so forth.
Okay, and then my last question, page 728, account 406115. What are the charges to other governments? And what other governments are being charged?
That's it. Yeah.
Mr. Chairman, I just want to verify the page numbers. Are we talking 588?
728.
Mr. Chairman, that's the upper payment limit.
And through the chair, what's the upper payment limit?
Mr. Chairman, up until a few years ago, it was more commonly known as the intergovernmental transfer. This is going to be a $17 million Medicaid payment from New York State to Monroe Community Hospital.
Okay. Thank you very much. I think that's all I have. Thank you all very much for your assistance in answering questions.
Any other questions? Legislator Keeley.
Thank you very much, Mr. Chairman. I only have about 20 questions, so it won't be long. Just kidding. Due to the wonderful questions being asked prior to me, I don't have but 2, actually. Going back to, through the chair, under the medical examiner, I think it's page 724, in the fee income dropped from $185,000 to only $31,215 and is now going back up exponentially to $130,000 expected in 2016. Can you explain that?
Through the chair, the medical examiner's office previously had entered with contracts for service with various different surrounding counties. We have since moved that to a fee-for-service, if you will, a la carte structure, which is more fiscally responsible and solvent in meeting the needs of our surrounding counties, as well as making sure that the costs of the medical examiner services are appropriately reimbursed.
Good answer. Thank you. And just briefly, wrong page. If we could go back to through the chair, this is slightly, it actually is, it's a question of concern. With the 2016 budget, I didn't see anywhere in there where it might have addressed the impact of Raise the Age coming down from the state. Has that been addressed in this budget, and if so, how?
Through the chair, Raise the Age is not addressed in this budget because we have no frame of reference to be able to address what it might cost us.
Thank you. And then just something that came to mind, I was actually asked. The majority of youth currently and then into 2016 are housed where and by gender? Where are females under the age of 18 being housed?
Through the chair, I'm unclear what you.
Well, excuse me, I didn't really ask it correctly. It's my understanding, or I could be wrong, through the chair, that it is only a male population in industry.
Through the chair, no, industry is co-ed.
Thank you. Then that follows that. That's it for tonight. Thank you.
Is there any other questions for the budget? Legislator Keeley. Or Legislator
Sorry, these,
Sarah.
through you, just two requests, if it's possible to get before the Ways and Means Committee meeting. The first would be a copy of the preliminary tax cap calculation sheet, please. And the second would be the third quarter key indicator report.
Mr. Chairman, I can certainly provide, Ways and Means is December 3rd, correct? We will do our tax cap filing by that date. I would be more than happy to provide a copy.
Thank you.
To be honest, Mr. Chairman, we actually haven't started work yet on the third quarter key indicator report.
Through the chair, must be due soon, right? Or perhaps a...
I'm sorry, Mr. Chairman, I thought the request was for the tax cap plus the quarterly key indicator report.
Yeah, the third quarter key indicator report?
Yeah, in all honesty, Mr. Chairman, we have not yet started work on the third quarter key indicator report.
Is it possible to receive a copy once you have completed it? I imagine it'll be
Absolutely, Mr.
soon,
Chairman.
given that it's almost December. Okay.
If I remember correctly, we filed in January last
okay.
year, but
All right. Thank you.
You're done? The next item on the agenda is new business. Madam Clerk.
Referral 15-0335.
Moved by Legislator Carbone, second by Legislator Dalhousie. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0351.
Moved by Legislator Dalhousie, second by Legislator Draw. Any questions? Legislator Keeley.
Thank you, Mr. Chairman. Through you to the administration, it appears that Morrison Healthcare is not local. Were there any local respondents to the RFP?
Through the chair, that is correct. They're not local. There was only one other respondent to the RFP, and they too were not local.
Thank you.
Legislator Keeley. Caroline. Andrews.
Thank you, Mr. Chairman. Through you, is this a change in delivery of the services, this contract?
Pardon me?
Is this a change, or is this who we've contracted with before?
No, it's not a change. Morrison's is currently at the building, and they've actually provided dietary management services at MCH for nearly 15 years.
Okay, thank you. And by passing this tonight through the chair, there's no change. This doesn't affect any current staff at the hospital in terms of layoff or reduction?
Again, I'm sorry I didn't get the whole question.
Just through the chair, will this contract create any layoff or reduction of current staff at the hospital?
Through the chair, no.
Okay, thank you.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0352.
Moved by Legislator Draw, second by Legislator Turp. Legislator Keeley.
Thank you very much, Mr. Chairman. I don't see it in the context of the referral itself. So through you to the administration, is this an increase? Does this constitute an increase in funding for 2015?
Through the chair, could you repeat the question, please?
This doesn't indicate in the referral through the chair whether or not this funding is an increase over funding in the previous period, and that's what I'm asking. Is this an increase?
Through the chair, it is an increase.
Thank you. And could you tell me, through the chair, certainly you can answer this in writing if you don't have it, how many homes or families were impacted this year through this period, and how much of an increase it was? Thank you. Mr. Chairman, okay.
Through the chair, this money is additional money that's given just for early outreach. So it's not actual HEAP funds that are issued to families, but we use this for early outreach to start the 2015-2016 HEAP season.
Thank you. Yeah, somebody had some.
Are you,
That's it, I'm sorry.
all those, any other questions? All those in favor say aye. Aye. Opposed? Motion carried. Next item, please.
Referral 15-0353.
Moved by legislator Turp, second by legislator Carbone. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0354.
Moved by legislator Carbone, second by legislator Delahanty. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried.
Referral 15-0355.
Moved by legislator Draw, second by legislator Turp. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Next item.
Referral
Moved by legislator
15-0356.
Turp, second by legislator Carbone. Any questions? Legislator Kaylee.
Thank you, Mr. Chairman. Through you to the administration, could you tell me what the county portion was? If it's the same as the prior years?
Through the chair, the county portion is fairly similar.
Thank you. Would that mean up or down? Fairly similar.
Increase.
Thank you. And then through you, Mr. Chairman, were there any other respondents to the RFP?
Through the chair, there were not.
And thank you. Is Coordinated Care Services the current provider?
Through the chair, yes, it is.
Thank you. That's it.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried.
Referral 15-0357.
Moved legislator Carbone, second legislator Delahanty. Penny. Whatever. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0358.
Moved legislator Delahanty, second by legislator Draw. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried.
Referral 15-0359.
Moved legislator Draw, second legislator Turp. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried.
Referral 15-0360.
Moved legislator Draw, second legislator Turp. Any questions? Legislator Keeley, is that a hand?
It is a hand. I think maybe I'm confusing this with something else that came across our desks in the last month or so, if I could. Didn't we just accept a grant for, no. No, I'm sorry. It was the contracts that came across. Will this funding go to handle the contracts that we approved 2 months ago? Thank you. Through the chair.
Through the chair, no, these will not provide funds to the contracts that the body ratified at the last meeting, as those were for pathologists and not toxicologists. I get them confused myself.
Thank you.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried.
Referral 15-0361.
Moved legislator Tepp, second legislator Carbone. Any questions? Seeing, oops, legislator
You know, if I had a buzzer, it'd probably be better, I don't know.
I'd turn it off.
Thank you. No, I'd buy my own. Buy my own. If I'm understanding this, you are just so cute tonight.
It's my last night, so.
And I don't see
Get my
any.
money's worth out of you.
Yeah, good, but we didn't get any food stuff tonight. Are we supposed to eat the berries?
Night's not over with yet.
Okay, all right. Sorry. Since this is a contract in addition to the nurses that are involved in the Nurse Family Partnership Program, what type of information is being shared with them to improve outcomes?
Chair, I believe you may be referencing the wrong referral currently. We are on 0361, which is the Medical Examiner's Office receipt of a Coverdell Grant Award.
No, I asked that question, thank you. No. I did, I asked the
We're on
question about
61.
that. I thought we voted on 361 already. We didn't? Let's get with it then. I'm all done.
All those in favor say aye. Aye. Opposed? Next item.
Referral 15-0362, acceptance.
Moved by legislator Carbone, second by legislator Delahaney. Any questions on 62? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0363.
Moved by legislator Delahaney, second by legislator Draw. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Next item.
Referral 15-0364.
Moved by legislator Draw, second by legislator Turp. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried.
Referral 15-0365. Amend
Moved by
resolution.
legislator Turp, second by legislator Carbone. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried.
Referral 15-0366.
Moved by legislator Carbone, second by legislator Delahaney. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0367.
Moved by legislator Draw, second by legislator Turp. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0368.
Moved by legislator Turp, second by legislator Carbone. Legislator Andrews.
Just a quick question here. This, who is currently providing who is currently the director of medical services for the Starlight Pediatric Clinic? Through you, Mr. Chairman.
Through the chair, it's Dr. Paris.
I'm sorry?
Through the chair, it is Dr. Penelope Paris.
Oh, so this is a renewal of her current contract?
That is correct.
Thank you. Does she see patients through the chair?
Yes, she does, through the chair.
Thank you. And is the contract terms the same as the previous one?
Through the chair, yes.
Thank you.
Any other questions? Seeing none, all those in favor say aye. Aye. Motion carried. Next item.
Referral 15-0369.
Moved by legislator Delahaney, second by legislator Draw. Legislator Kaylee.
Thank you, Mr. Chairman. Briefly, has a study such as this been done prior?
Through the chair, are you specifically, what specific study are you speaking to?
This is $30,000 to provide research related to county health priorities among African American and Latino populations. My question is, has a study such as this been done prior?
Specifically, through the chair, this contract specifically supports the Finger Lakes Health Systems Agency in, again, supporting certain strategies that are developed by the community, including in the Department of Public Health. It does not contract for a study per se. It is a contract to facilitate community health improvement through a number of venues. In some cases, that allows us to have access to data that otherwise we would not be able to have to investigate and address health disparities within our community.
Thank you. That's it.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed, motion carries.
Referral 15-0370.
Legislator Draw moves it. Second by Tep. Legislator Kaylee, was your hand up?
Thank you. Briefly, I'm assuming that the U of R has provided this service before, so I would just ask that if it's not available, if we could have numbers of cases up or down, or if there have been any changes over the last couple of years. Thank you.
Through the chair, if you would like an exact number, we can provide those to you. However, on average, our TB clinic sees approximately 1,100 patients for multiple visits throughout the calendar year, and that has not varied significantly over the last 5 years or so, including the number of active TB cases that the Department of Public Health investigates and treats.
Thank you. Then if I could ask, just for an accounting of new cases over the last 5 years. So the study, those figures would be appreciated. Thank you, and that's fine in writing.
Through the chair, I can do that.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed, motion carried. Next item.
Referral
Moved by legislator
15-0371.
Second by legislator Carbone. Any questions? Legislator Kaylee.
Thank you. Through you to the administration, have these three entities held these positions prior?
Through the chair, two have.
Thank you. They would be?
Through the chair, Ms. Russell and Ms. Spencer.
Thank you. And through the chair, if our research is correct, attendance for the appointee of the municipality should not be required for a quorum at these meetings. I guess what I'm asking for, and I can take this in writing, is in the past of those two that are returning, what their attendance has been for the length of time that they have been our representatives. And I can have that in writing. Thank you.
Through the chair, okay.
Any other questions? Seeing none, those in favor say aye. Aye. Opposed, motion carried. Next item, please.
Referral 15-0372.
Moved by legislator Carbone, second by legislator Delahanty. Any questions? Seeing none, all those in favor say aye. Aye. Opposed, motion carried.
Referral
Moved by
15-0373.
legislator Delahanty, second by legislator Draw. Any questions? Seeing none, all those in favor say aye. Aye. Opposed, motion carried. Next item.
Referral 15-0374.
Moved by legislator Draw, second by legislator Tep. Legislator Andrews.
Chair, I may just have not have noticed this in the past, but is this the usual amount for our busing contract here, the $15 million, through the chair?
Through the chair, keep in mind this amount is over a 3-year contract period. This is a new contract. Again, this is a mandated service that the county is obligated to provide, and those services are unfortunately rather expensive.
Through the chair, then, what's the cost for each of the 3 years, please?
Through the chair, it is the $15 million appropriation.
No, through the chair, I see that. I was just curious if you could break it down for me, year 1, year 2, and year 3.
Through the chair, it is roughly $5 million a year during that period of time. To clarify, that number can increase or decrease slightly each year based upon the number of children that are involved and enrolled in either early intervention or preschool education programs. So that number could ultimately vary.
Thank you. Then what was the cost of the current year for this transportation, through the chair?
The Legislator Amy.
Through the chair, I'll get the answer to you.
Thank you. And through the chair, is our current contract also with Monroe School Transportation?
Today, yes.
And for the past 3 years as well, or how long have we had a contract with Monroe School Transportation through the chair?
Through the chair, I'll have to research that.
Thank you, but we do have a current contract with them to provide transportation for this year through the chair.
Through the chair, that is correct.
Thank you.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0375.
Moved by legislator Turp, second by legislator Carbone. Legislator Andrews.
Mr. Chair, are these the same 3 providers that currently provide this service?
Through the chair, no.
Can you tell me who currently does through the chair?
Through the chair, nursing services, as of today, are provided through a contract with the University of Rochester Center for Nursing Entrepreneurship.
I'm sorry, so there are 2 currently? Or is it just 1?
No, it is one contract through the University of Rochester Center for Nursing Entrepreneurship, which is the full title.
Okay, thank you. And why is the change being made through the chair?
Through the chair, the services were RFP'd per our usual contracting process, and the current vendor chose not to respond to that request for proposals.
Perfect, thank you.
Any other questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0376.
Moved by legislator Carbone, second by legislator Delahanty. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0389. Authorized.
Moved by legislator Delahanty, second by legislator Draw. Any questions? Seeing none, all those in favor say aye. Aye. Opposed? Motion carried. Next item.
Referral 15-0390.
Moved by legislator Draw, second by legislator Turp. Legislator Cayley.
Thank you, Mr. Chairman. Through you to the administration, while I was going through the additional information that was given to us about past previous year's outcomes and expectations, I was a little bit concerned, and it may be that you can just give me the information at some point, that at least 3 of the agencies that will be receiving funding have not indicated any outcomes for 2014 or 15, which understandable for 15, or their expectation for 2016. And I'm just a little bit concerned that there is no information in those particular areas where in the majority of the contracts there are. Can you explain that?
Yes, through the chair, could you just mind listing the 3 agencies that you're referring to?
Sure. I believe the first one is Compeer.
Okay. And the other 2?
Charles Cinnamon House has theirs. Big Brother and Sister.
Okay.
And the other one is ABC. Now, I know that these programs are ongoing, and just would be concerned that there's no indication of what their outcomes have been in terms of numbers of students, youth reached.
Yes, through the chair. The reason that you would see no outcomes for the last few years is because those are 3 new agencies that the county will be contracting with starting 2016. The EOI went out, and those 3 agencies were selected by a group of folks, including Commissioner Reed and myself, and we thought those 3 agencies would fill needs that we are not currently fulfilling in the county from the Youth Bureau perspective.
Thank you. I appreciate that. But would it not be reasonable to at least have a projection through the chair?
And they do them in the, through the chair, they do provide those in the EOI, and we can get those to you if those aren't provided for you already.
Thank you. I would appreciate that.
You're welcome.
Any other questions? Legislator Andrews.
Thank you, Mr. Chair. Could I request a list, please, of the private agency contracts for 2015?
Through the chair, yes, we'll get that to you.
And the dollar amounts associated with them as well, through the chair.
Yes, through the chair.
Thank you.
Legislator Skeeley.
It just, something came to mind, and thank you, Mr. Chairman, because it was mentioned in the budget questioning as well. These are, with Compere, Big Brother and Sister, and ABC, these are EIOs? EIO. Didn't mean to do
Old
that,
McDonald.
but just,
Through the chair and Old McDonald, yes, it is through the EOI
It fits.
portion.
thank you. My question to that is, how quickly is that in turnaround time to have that agreement, or can you just give me a little bit more information, since that's kind of a new concept for us, for me? See, if I could, do you understand what I mean? Thank you.
Yes, through the chair, I'm sorry, if you could just clarify, what, like, for the actual process of the EOI that we went through, or?
The OL process.
You've gotten an interest, obviously, there's an interest here with these three agencies, and you are willing to go forward with them. What is the process after that? Since you don't have any projections, you don't have a program set up, or they're setting up a program, thank you through the chair, how fast a turnaround happens to get this program going?
I think they have a projection they were going to give to you, but they just didn't have it in the document.
Well, what I'm asking for is timing.
If you're looking for, excuse me, through the chair, if you're looking for what they provided us to make that choice, we can get that to you fairly quickly.
No,
Then, through the chair, I'm at a loss.
me too.
That makes three of us.
The final process of the EOI, I mean, you've got them hooked up, and they're all set, and you're gonna give me the projections, and you're gonna turn around in January 2016.
Yes, through
and
the
start a
chair.
program.
Yes, that is correct. Through the chair, January 1st would be when they begin these programs.
All right, good enough. Thank you.
Thank you.
Any other questions? Seeing none, all those in favor say aye. Opposed? Motion carried. Next item.
Referral 15-0396.
Moved by legislator Turp, second by legislator Carbone. Any questions? Seeing none, all those in favor say aye. Opposed? Motion carries. Are there any other matters become before this committee? For all you that are dying to know what the food of the month was, I was going to bring the live turkey that we're going to have for Thanksgiving, but I did not think it was going to be humane to put the turkey through this committee cycle. Plus, my family was very concerned that the legislators, President Adair, would pardon it, and I would not have a turkey dinner. So for that reason, I did not bring the turkey in. But turkey is the food of the month. With that, yes,
Stand it.
okay.
Is this turkey already plucked, and what is your preferred cooking method?
In the oven, and it's not plucked because it's still walking around. It's not humane to pluck them before you kill them. After you chop the head off, then it's okay. There are no other matters becoming before the November 17th committee of the Human Service Committee stands adjourned. The next meeting of the Human Service Committee will be announced by somebody else.